No, बरोबर. या बरं चोक राऊंड सायकल तुझं. ये मुके
Good afternoon to one and all present over here. Today we have gathered here for the expert talk by Dr. K.O. Bush. He is an MS Ortho and MCH Ortho from UK and FRCS Edinburgh and FRCS TR and Ortho. He is a consultant orthopedic and joint replacement and arthroscopy and trauma surgeon, and he's knee, shoulder and hand surgeries, and his special interests are orthobiology. He is an honorary adjunct and associate professor at Bond University Medical School at Gold Coast, Australia, and he is associated with Epic Hospital and Saraswati Hospital in Ahmedabad, India. He is also an orthopedic consultant at Sarvichar Parivar Charity Clinics and Indoor Rehab Center at Satellite Road, Ahmedabad, and he was a former consultant and orthopedic and trauma surgeon at Royal Oldham Hospital, Northern Care Alliance NHS Foundation Trust, and BMI Private Hospitals at Greater Manchester, UK. He is a trainer and surgical coordinator and orthopedic surgeon for SATI, that is Surgical Accredited Trained Healthcare Workers Initiative, Global Surgery Project at Ahmedabad with Fulbright Distinguished Chair Professor Rahul Jindal, Sat Charitable Trust and Mukul Jadhav Foundation. He is a mentor for health tech startups at iHub Gujarat, and he is an orthopedic and sports and trauma surgeon to Sports Authority of India, Western Zone HQ in Rajasthan, MP, Maharashtra, Goa and Gujarat, and at Gandhinagar, Gujarat at Commonwealth Games at Birmingham, UK. He is the founder at Sushruti Health Global at Bhartiya Healthcare, Education, Apprentice, Liaisons, Training, Holistic Innovations in and from India. He is an advisory board member at Sampark Bharti UK and Global Sanatani Professional and Business Organization. He is an honorary advisor for National Innovation Foundation, New Delhi, India, and honorary advisor at Kahani Football Academy, Ahmedabad, India. He is a member and thought leader panel, BBC Radio Manchester, and he is a former management board member at Bhartiya Vidya Bhavan, Manchester, UK. So can we please have a huge round of applause?
So good afternoon, everybody.
Good afternoon, sir.
So is everybody properly sleeping? 2:30 in the afternoon in Indian summer. Normally we should be sleeping. Most of my talks are interactive and immersive, and PowerPoint is just a trigger. So I don't want you to go into the slides because I myself don't like the PowerPoint very much. Because I consider PowerPoint Gujarati, Hindi, English, सब कुछ चलेगा ना?
Yes.
I am always interested in interacting with people sitting in the last two rows. So those who are thinking that they are sitting in last 2 or 3 rows will somehow escape my attention. That's not going to happen because I am the son of a teacher. And that also high school teacher in St. Xavier's Gandhinagar, running a class of 50, 60 students, 70 students at a time with a pin drop silence. And she would know if there is a cricket match going on In those days there were no mobile phones, so there were some small radios available, and somebody is listening to the commentary on the small radio, and she will pick them out. So I can interact with each of you individually even if I don't know you. So that's the first thing. Now the topic is knee and shoulder, what's hot and what's not. I see that a lot of you are in, because as I was said with your principal, a young lady came and she wanted to get signature because she is taking part in national karate event in next few days. Does anybody know her? From your college. There is a girl in your college who has been selected for karate at India level. Right? So there are plenty of young sports people in physiotherapy field who are physiotherapists and also playing sports. And I know a few of them. So, because I saw her just 5 minutes ago, I'm going to say something before my next slide. Have you guys all heard of RICE, R-I-C-E, after injury? So raise your hand if you have not heard of RICE. Because, so I take it that everybody knows what RICE is, correct? So that young lady at the back, over there, next to you. Stand up. What is your name? Mahima. So what is RICE? After injury, somebody gets ankle sprain. Whose name is Mahima? Okay. What is RICE? Because you said you know RICE, correct? Okay, don't worry. You will learn after today. So it's good that you stood up. So who else definitely knows what RICE is from the students? Raise your hand if you know RICE. Stand up. What's your name? Akshat. What is RICE? Loudly. Compression and elevation. So everybody heard what he said? So do you all agree and believe that somebody comes with an ankle sprain from a sports field, which is kabaddi or tennis or karate or basketball or anything, cricket, and they get knee swelling, the first thing you should do is RICE. Does everybody agree with that?
Yes.
Yes or no?
No.
No, only the students, because faculty will know. So, but among the students, everybody agrees with that?
No.
Oh, so who doesn't agree with RICE? You are a student?
Yes.
Okay, stand up. That's fine. Go on.
Yes, sir. Because whenever we get an injury, our body.
What is your name? Sorry.
Atharva.
Atharva. Okay, why do you not agree with RICE?
Because
This is very important because RICE is practiced across the world. And this talk is going live on YouTube across the whole world, okay, right now. So you all are going to become famous. And if Ahmedabad Physiotherapy College has an Instagram channel, you can make it live there also. I will promote your college through this talk. So I don't know if anybody has access to Instagram channel, then you can go live now. So why is RICE not good? Now this is a very serious topic, okay, because it applies to all of you.
actually, whenever our body gets an injury, our body
Just stand here so everybody can see you talking. Okay.
basically, whenever a body gets an injury, our body's first response is for swelling. That is an inflammatory response.
Okay.
Our body tries to fight back and tries to recover itself. So if we apply ice, our main inflammatory responders will get slowed down, because whenever we apply ice, there is your Levy-Hunting point where there is a compression of your artery. So necessary pro-inflammatory reactors will not come.
So I will explain what Atharva said in a very simple manner. Okay. That is the advantage of getting old, that you can simplify things. You know, sometimes you go to your papa or dada dadi and you can base થઈ જશે. કેવી રીતે થઈ જશે? I cannot understand. But he has experience of 40-50 years, so they can work out in their head and tell you just one sentence. So why R also is not good, rest is also not good. He said about ice, but rest and ice are not good. Why? Because in one sentence they stop inflammation, and without inflammation you cannot have the healing cells going in the injured area. So ice will reduce the blood flow and rest will also do the same thing. So the current, so what is the answer? R and I reduce the inflammation. Actually R reduce eye inflammation. So actually rest and I, you can have these manomics, reduce inflammation. Two meanings of RI. What is the third meaning of RI? Does anyone know? Anybody else? So sir, you said something. Somebody said something.
Reciprocal inhibition.
Okay. No, this is outside of the field of medicine. So I want to know your general knowledge. Because who knows, one of you might be applying for GPSCs. Do you know what RI stands for outside the field of medicine? Rigorous imprisonment. Okay, if somebody has done bad crime, they get rigorous imprisonment. Okay? So you don't want to put the limb in rigorous imprisonment by giving rest and putting ice. Okay? That's why I brought in that terminology. So what is the current nomenclature? What should you do immediately after injury? Anybody else who has not spoken? You can raise your hand, otherwise I will find you just by shutting my eyes and putting my hand over there or there. What should you do in the immediate? You know, I said what is hot. So I started with the temperature, correct? So we are avoiding cool. We are avoiding cold. So what is good in the immediate phase? Does anybody know any, like rice, any other menomics? Or not, because you seem to go. Sorry, somebody said something. Who said that? Who said? You said that? Stand up. What's your name? Mansi. What did you say? Peace and love. Okay? Right. So the second one is for 14th of February, but today we will stick to PEACE. So what does PEACE stand for? Okay, or protect. Because somebody is injured by the roadside, you got to, or somebody is in the middle of the football field, everybody is running, you have to protect them. Okay, then E is what? Okay. A is for?
Avoid anti-inflammatory.
Those who have spoken will not speak unless I say. No, avoiding anti-inflammatory medication. And I'll tell you more about it in a minute. C is for? Operation is still good. Elevation तो आ गया, दूसरा ही क्या है? दूसरा ही क्या है? अभी क्या चल रहा है यहाँ? Education. You have to tell the guy कि ऐसा मत करना, otherwise your injury will get worse until he reaches the hospital. Or counseling, you can call it. Counseling and education has direct impact on the outcome of the treatment. Okay, so it's not some PR exercise. All right. So good. You took the courage to stand up and spoke. So give a little clap to Nam. So now I was talking about anti-inflammatory. Does anybody know names of any anti-inflammatory medications? Raise your hand. Don't just speak. Okay, stand up. What's your name?
Yash.
Yash. Name and anti.
Enzoflam.
No, that's a trade name. Give me a proper name.
Diclofenac.
Diclofenac. Okay, you also raised your hand. Stand up. Your name? And what? Levofloxacin. That's so she tried. It's an antibiotic, but good try. Okay. So one diclofenac. You can sit down. Any other anti-inflammatory commonly used? Somebody knows? Raise your hand. Don't speak without raising your hand. So he seems to be the cleverest of the whole lot, right? Who else has not spoken? Raise your hand if you know name of any anti-inflammatory medication other than diclofenac. Don't just speak, raise your hand. What is to be ashamed of? So, तुम्हारे ही दोस्त हैं यार. Those who have not spoken. You are supposed to raise your hand first. But Dynapar includes diclofenac, which you already said. Any other? I'll give one more chance to one person. Stand up, stand up. What's your name? What's your name? Shreya says aceclofenac. So we have two anti-inflammatories. Take a seat. Then the simplest one and the commonest one that is used is ibuprofen. Profen. Right? and combined with paracetamol, it is called Compiflam. You heard of Compiflam? Now you should not use that in acute injury or even after fracture surgery for pain relief, because it inhibits the fracture healing, it slows down the fracture healing. So if you have major fracture surgery done by a very popular, famous orthopedic surgeon, everybody will give you his name, go to him, he's best at fixing the fractures, and then post-operatively, these patients are getting dynamo injections. And then the patient needs revision surgery. And then you say, okay यार, मैंने तो बेस्ट से बेस्ट सर्जन के पास सर्जरी करवाई तो मेरा लक ही ऐसा होगा. मेडिसिन में लक बहुत कम जगहों पे काम करता है, बट ऊपर वाले की इच्छा, भगवान की इच्छा ठीक है मन मनाने के लिए, बट साइंटिफिकली इफ यू आर नॉट करेक्ट तो इवन भगवान विल नॉट हेल्प यू, बिकॉज ऑन दिस प्लेनेट वेयर वी लिव knowledge is the power, right? So any Bhagwan or any god of any religion will not tell you that be ignorant. And somehow if somebody tells you that your culture tells you to be ignorant, that's a wrong culture, because people come to harm. Your own family members will come to harm if your own doctor is not knowledgeable enough, or if you are not knowledgeable enough. And how to acquire knowledge is the key that I'm going to teach you today, okay? I can teach you so many things, videos, etc. I've given Mansi 20 videos probably. But my purpose is not to dazzle you with what I have done. Next slide. Yeah, sir?
Just a touch.
Or just swipe? Oh, okay.
Yeah.
So there's a second slide. This is bit of information for you. So उसके पहले भी एक slide थी. I like this, by the way. 23% population in India has some knee injury. That is 1/4 of the population. Just imagine. 85% of knee injuries are to the anterior cruciate ligament. ACL tears can be treated without surgery in many cases. Did you guys know that?
Yes.
Okay. ACL operations per year, India 125,000, that is 1.25 lakhs. USA 4 lakh. USA population is 1/4 of India. But they are doing 3 times the ACL surgeries that we are doing. So who is right, who is wrong? Are we doing too few? Are they doing too many? I worked in USA for a year and I know the answer, but I would like you to search and find out. And if you Google under unnecessary operations in USA and then you put the name of the operation, you will get some idea. It doesn't mean that every operation is unnecessary, okay? Don't mislead the people either. And I'll talk about this ACL treatment without surgery in a little bit. Now, commonest causes in India is a particular thing called what? What is the commonest cause of ACL injury in India? सीधी बात है, एक्टिवा. So, sports is becoming more and more common cause. And you all know RTS. Who is doing sports, masters in sports or musculoskeletal therapy now? You raise your hand. What is RTS? Who said that? Stand up. What's your name? Sharmin. So RTS is returned to sports. Just see this, only up to 50 to 60% of athletes, especially in ACL plus meniscus or condyle injury. So only half of them only half of them will return to their original sports level. Not just with ACL, with many injuries. Anybody follows football from this room? Like watching properly on the television? Other than Atharva? You watch football? Very good. Which team? Stand up again. Which team do you follow? थोड़ा जोर से बोलो यार. Occasionally, which team do you watch? Madrid. Real Madrid. Good, good. Anybody else? So there was a player in Real Madrid many years ago called Michael Owen. He used to play for Liverpool. And his running goal from one end to another is one of the most famous goals in football history. Michael Owen got a foot fracture. Now, when you are a VIP, you get VVIP treatment, right? So normally metatarsal fracture, what do you do? What do you do for metatarsal fracture? हाथ ऊंचा करने में क्या तकलीफ जाती है? मुझे भी अच्छा लगेगा. I can talk to one person at a time. Metatarsal fracture में क्या करते हो generally? You have spoken. And anybody else who wants to speak, you have to raise a hand. Okay, I will pick out somebody who has not spoken. Yes. Stand up. What's your name? Dhruval. Dhruval. What do you do for metatarsal fracture?
If the case is worse, then we go to surgery. If the case is worse,
Tell me the commonest thing that happens with metatarsal fractures. What is the most likely thing to happen? If somebody breaks their fifth metatarsal, what is the most likely thing to happen?
plaster cast.
It is going to heal by itself.
Yes.
Majority of the times. Right? Now, you said plaster cast. Does everybody agree with him?
No.
Who disagrees with him? Raise your hand. Who has not spoken? तो जिसने नहीं बोला है उसी को मुझे खड़ा करना है. You at the end. Yeah, stand up. What's your name? Shashank. So he said plaster cast. Do you agree? Metatarsal fracture. Yes or no? No? So what do you do if not plaster cast? Let him suffer? ये कैसे करोगे इमोबिलाइजेशन? हवा में से आएगा इमोबिलाइजेशन? कुछ तो करना पड़ेगा ना. हाथ पकड़ के बैठ जाओगे उसका पैर.
Taping and bandage.
Taping and bandage. Okay, good improvement. Anything else? Metatarsal base fracture में participate होते हैं? Not really. चल रहा है उसके ऊपर. Has anybody heard of something called air cast boot?
Yes.
Air cast boot. With that, you can return to work the next day, not to sport but to work. And you can stand, you can walk. At the time of shower, you can remove it. And even today, I am ashamed to say that many parts of the world, metatarsal fractures are treated with bandage or plaster. And then they are told after 3 weeks you can have the air cast. बेचारे की 3 हफ्ते की जिंदगी का क्या? If somebody is working in a private office, what will happen? 3 weeks salary gone. और घर में भी घर वाले भी बोले कहाँ ये बैठे बैठे कुछ काम नहीं कर रहे हो, तो घर में भी गड़बड़ हो जाती. मम्मी बोलेगी कुछ कर नहीं रहा है 3 हफ्ते के लिए, whatever it is. But if real injury is there, you have to rest. But for metatarsal fractures, air cast boot should be and can be used on day 1. In England, it is known as Beckham boot. David Beckham was another big footballer, and he popularized this particular air cast boot because of his metatarsal fracture. So Michael Owen had a surgery for his metatarsal fracture. A screw was put in. So his fracture actually went into non-union. Whereas it could have healed just with a air cast boot or even a bandage. As a result, he needed second surgery. And then he never reached the same level of sporting excellence. So it is important to understand the fracture personality. Now, HS is hamstring and lateral extra-articular tenodesis is better than just the hamstring graft for ACL. Okay. So now I routinely do LET, especially in a young person. Quadriceps tendon is perhaps better than HS or whatever tendon. And saving original ACL, that is another thing which we do. I recently operated on a 21-year-old girl and we restored her original ACL. I don't know if I have got the video here. Which video is this? Okay. Non-operative treatment of ACL, of course, physiotherapy is at the top. It is always at the top before and after surgery, or with or without surgery. Advanced bracing. In Ahmedabad, I initiated the culture of having physiotherapists sit with orthopedic surgeon during consultation for the first time. And I got a lot of bad comments, a lot of negative comments, and now literally every other orthopedic surgeon in Ahmedabad has a physiotherapist sitting with me. This was our practice in UK. We had an extended scope physiotherapist and they worked to a protocol. So for me it was normal. For here everybody was looking at me. So, but I am one kind of person who doesn't care what rest of the town talks about me, as long as I know what I am doing and the person with me knows what he or she is doing. Because otherwise you cannot make impact in this world. Okay? So that's why physiotherapy is very important. Advanced bracing, there are ACL braces and there are ACL braces. And I think it's a subject of orthotics and prosthetics, so I will not go much into it. Advanced PRP. Everybody has heard of PRP, right? What is PRP? Anybody? Raise your hand. Or shall I ask somebody else to stand up? Okay, you have not spoken. What is PRP? What's your name?
Shambhu.
Shambhu. What is PRP? Anybody knows what is PRP? Then raise your hand. Then I don't have to go through the. You know everything, so I'm not going to get this. Okay, see, anybody else knows PRP? You can Google it. I don't mind. Platelet-rich plasma. Why I use the word advanced? Because it depends on the concentration of the platelets in that collection. You can get an ordinary PRP which is very cheap and easy to make, but the concentration will not be good. It is used for baldness. Yes. Multiple injections are given over a 6 weeks period. PRP, you can't inject somebody's knee for 6 weeks every single week. They might get infection. So the orthopedic PRP is different. And the one that I use originally I used to use the one coming from a company called Zimmer Biomet. It's an American company. And now I use from another company which is South Korean company. It gives one of the highest concentrations of platelets. And sometimes if there is a cartilage damage, and for ACL you have to use leukocyte-rich PRP. For osteoarthritis you have to use leukocyte-poor PRP. This week I got 2 patients coming from Australia for these injections. Because in those countries, either it is not available or it is extremely expensive. For example, the high concentration PRP injection in USA without the hyaluronic acid or hyaluronic would cost $7,500 US, which is how many rupees? Anybody? Without seeing that, without googling, you can Google still. It is 6 lakh rupees just for one injection. If somebody does it for 1 lakh or 1,20,000 here, it's still expensive, but not as expensive. And stem cells. Has anybody heard of stem cells? Anybody knows anybody who has had stem cell treatment for orthopedic knee problem, ACL problem? Anybody knows of anybody? So in India, we can have stem cell in 2 ways. One is your own cells. That's a 2-stage procedure. First stage, we have to take cartilage from non-weight bearing part of the knee with arthroscopy. And we send it to the lab, and they produce the cartilage cells or tendon-related cells or whatever, and give us back in 6 weeks. And we reinsert them through open procedure. Quite invasive, 2 operations. However, with the ICMR, Indian Council of Medical Research, and Drug Control General of India, DCGS, have approved allogenic stem cell, which is stem cells collected from various individuals from fetal cord blood, and they are banked in a company in Bangalore. And those stem cells come to you whenever you want to inject them. And they come in a flight, the stem cells, okay? There's a separate ticket taken for the stem cells in a big casket, inside of which the temperature is minus 77 degrees. And just like Khulja Sim, the box opens and that little thing comes out of the big casket. So it feels like that. And then it has to go through certain process, then you inject in the knee, and with that you inject the hyaluronic that comes with it. And I've been using that in Ahmedabad for moderate osteoarthritis patients of the knee, okay, including some IAS officers and people of that background. Now these, I don't know, will this come up, Mansi, this video? ऐसा करने से आएगा? क्या बात है। तो ये अपने नेशनल ग्लोबल लेवल प्लेयर है कि लोग स्पोर्ट्स ऑफ इंडिया में बहुत अच्छा स्कूल दे रहा है कि बस और प्लानर्स के लिए एसी अपनी कंस्ट्रक्शन और खैर उनको काम अपना क्या हुआ है कोर्स यही कैसा है तो अभी वो क्या की इंग्लिश में ऐसा काम करो चंद्रशेखर हैदराबाद तेलंगाना में फोन करो ट्रेन है कोई ओके और ये बंदा आपका क्या नाम था सबने इसको इसमें के लिए काफी लोग पता चल रहा है तो थोड़ी गुजरात को ऑल द बेस्ट और फिजियोथेरेपी वगैरह आपको बहुत बढ़िया ऑल द बेस्ट शॉपिंग
दोस्तों क्या आपके एमएस ऑफिस सॉफ्टवेयर के ये वाला ऑप्शन ध्यान से मैं गारंटी के साथ बोल रहा हूँ कि आपके पास ये आपके पास कब आएगा 5 साल
ऊपर से cancel कर दें।
इस ऑप्शन को यूज करके मतलब काम तो मैं वो बारे में आपको बताना चाह रहा हूँ ये ऐसा
वो बंद कर पहले अपूर्व
अगर आपको
मेन सीट पर ये भी बंद कर
ठीक है I have learned this. So you saw that we have two young national level athletes sat next to each other. एक को हमने ACL की सर्जरी रिकंस्ट्रक्शन से ट्रीट किया था, hamstring graft and lateral extraorbital tenodesis, and the other one we treated actually with PRP injection, knee bracing and intensive physiotherapy, and both had good results. So patient selection is very important. ACL graft thickness is very important. Minimum graft thickness should be 8 millimeters. But it varies. Somebody who's big and tall and compared to somebody who's very small and thin, the thickness, if you use a 9 or 10 millimeter graft in somebody who is very thin and short, there will be a lot of ACL impingement. They may get re-tear of the ACL or pain. And if you use a smaller graft in somebody who's big and tall, then that will also re-tear because it won't be able to take the strain of that person's requirements. So the graft sizing is very important. There are many other criteria on the MRI scan that are used to decide the graft size. Okay? And there are technical things. I mean, you should know this because you guys are more in touch with the patients before and after surgery than we are. If you know, the patient will have more confidence in you. So the things that are used on MRI scan to decide the graft size are the tibial insertion size of the ACL, which you can always figure out in MRI scan, and the intercondylar notch width. Those are the two main criteria. So, shoulder pain. What are the common causes and diagnoses? Now, each question is designed to stimulate your thinking or to teach you something. Okay, so who has not spoken? The one next to you. Yeah, please stand up. Yeah. What's your name?
Lakshmi.
Okay. So what are the common causes or diagnosis of shoulder pain? Tell us.
Adhesive capsulitis.
Okay, speak loudly.
Adhesive capsulitis.
Yes, one.
Impingement syndrome.
Impingement syndrome. Yes.
Rotator cuff injuries.
Rotator cuff injury is 3.
Labradors.
Labral tear is 4.
Bursitis.
Bursitis is 5. Don't prop that. Don't prop that.
Bicipital tendinitis.
6.
Dislocation.
Instability 7.
Yeah.
Okay. Oh, fracture, infection और कैंसर को बात कर देते हैं.
Periarthritis shoulder.
Okay, good you said it. Never ever use that term for your entire life again. It belongs to 1980s, long before you were born. But it's not wrong before because it is old. Because I am older than 1980. So something is wrong Not just because it is old, but is it completely outdated and it has no meaning? Everything else you said had a meaning. Bicipital tendonitis, everybody can say कि biceps tendon में कुछ गड़बड़ है. Yes or no?
Yes.
Right? So ठीक है. अभी क्या बाकी रह गया?
Cardiac issue also there is
So, oh, absolutely. So he is talking like a faculty, but are not restricting to the actual shoulder itself. Okay? And I only want the students to answer. Otherwise, वो तो अच्छे ही हो गए. ठीक है, चलो ऑब्जेक्ट सब्जेक्टिव बात हो गई. पैथोलॉजिकल डायग्नोसिस. Okay, acromioclavicular joint arthritis. Okay, instability की बात हो गई. Okay, so 8 causes approximately we have counted. अभी एक बाकी रह गया जिसमें severe pain होता है shoulder. Anybody who says that other one will get a special coupon to any place they like in Palladium Mall. For food, we can take Atharva with you. Right, go on. Supraspinatus? Tear तो बोल दिया. Somebody said about tear.
Bankards and insect lesion.
So Bankart is lateral tear in a way. See, all knowledge is in you. It's coming out. बोलो.
scapular disc dimension.
It's a finding. It's not a pathology. You are saying something. What? Which syndrome? Okay, no.
Referred pain.
Referred pain. वो तो बताया आपके But फ्रैक्चर की तो बात, फ्रैक्चर, इन्फेक्शन और कैंसर, बोन कैंसर, तीन को रूल आउट कर देते हैं. What is that? Complex regional pain syndrome बोला किसी? This is shoulder related pain. Okay, I will give you the name and then it's calcific tendinitis. Have you heard of that?
Yes.
It is the most severely painful condition of the shoulder. If you rule out fracture, acute infection or acute cancer pain, okay? And it's very, very common. So this is the question. Other than infection, cancer, acute dislocation or fracture, what is the most severely painful shoulder condition? It's called calcific tendinitis. I know patients who underwent shoulder arthroscopy because somebody thought that this is a septic shoulder and the shoulder was fine from inside and they found a calcium deposit. And then they injected steroid and withdrew it out and then the patient got better. But the arthroscopy was not needed as the first line treatment. So once you diagnose acute calcific tendinitis, then steroid injection is the best treatment. Okay? And which steroid to use? Something called triamcinolone. It's currently considered the best locally acting steroid. अभी बताओ ये क्या है? नहीं, you will know. Students को बता दो. Can anybody say what this might be? If you are yes, then I will not let you speak. If you are wrong, I will say no. So who has not spoken yet? You stay in the middle. Yes. I'm talking to you. Yeah. Then after you. Behind you. What's your name? Vishaka. What is this? हमारी उम्र है कि नहीं बेटा संभला तो मुझे. What is it? Yes. What's going on? Good start. What's going on? What's going on? Anybody else want to try? Not amongst yourselves, huh? अंदर बात नहीं करने के. Otherwise, I'll make you stand up. Okay, you stand up next to you. What's your name? Mahi. Okay, what is this? So everybody can see a fracture, right?
Yes.
Something has come off from which part? Humeral head. Now, if you remember, try and remember a normal shoulder X-ray. Can you see the socket and the humeral head as a separate entity, or they are usually overlapped? They are overlapped, right? When you see them as separate entities, what does it mean? Shoulder is dislocated.
Dislocated.
But in anterior dislocation, it actually overlaps even more. In this posterior dislocation, so the socket is completely empty. 70 to 75% of posterior dislocation of shoulder are missed initially in almost any part of the world. How many? What percentage?
70%.
Right. This patient was admitted to another big hospital and somehow ended up with me. They took a discharge and came to me. And then we did whatever was required. It's in one of the links that I have sent to you. Who is this? Not this. Okay. Stand up. Stand up. Stand up. What's your name? Madiha. Who is he? Everybody knows who Baichab. Stand up. Tell me, what's your name?
Ex-Indian captain of football.
What's your name?
Harish.
Harish. India football ex-captain, right? Now, why have I put this picture? Just because I met him and I want to impress you? No. I am beyond that stage of life. The reason is because he was playing for a football team called Bury Football Club near Manchester. Okay? He was the first Indian, I think, to play for English Football League. Not a Premier League team, it was a league below. However, he injured his knee and he came to the same private hospital where I was practicing, called Highfield Hospital, BMI Highfield Hospital. And I didn't know, I just thought that he was somebody looking familiar. And then, you know, our team saw him, etc., and he had ACL surgery done. After some years, I met him in Ahmedabad because he started his Baichand Bhutia Football Academy in near SP Ring Road. And I said, do you remember? He said, of course, you look familiar. I said, go back to, I think, 15 years or 10 years. And then we talked about it. And that's when we had this picture. So what I'm saying is, after this ACL injury, excellent surgery, Baichand Bhutia actually returned to his original level of sports. And what I want to share with you, that if somebody has ACL injury, when they had surgery, their chances of going back to the original level are more if the patient is male and is below 25. Okay, females have slightly lesser chance of returning to sports. Now, who is this? Anybody else? You can tell which sports we are. Yes. Then he's a boxer, right? You know, or other than you. Vijendra Singh, right? He's the Olympic medalist, Indian boxing champion, big shot in the field of boxing. Why I put this photograph here? Anybody can make a guess? Okay, what is the commonest injury people, boxers get? Metacarpal, wrist. No, it's shoulder. And Vijendra Singh taught me that. He said, Dr. Saab, kya hota hai? And then he made me wear his glove as well. It's a really amazing feeling to wear an international Olympian boxer's glove. It's very different. So once you wear the glove, your hand is more or less locked like this, straight. And when you are boxing, the force goes all the way to the shoulder. It is only when the idiots do boxing that they fracture the metacarpal. When the professionals do the boxing, they actually damage their shoulder. Which is the other sports where shoulder is most damaged? Cricket. Who said cricket? Yes. Why in cricket the shoulder is very commonly injured? Because of the throw, because of the bowling. Do you know famous cricket bowler who had 6 or 7 shoulder surgeries for dislocation? Australian spinner. Shane Warne had 7 or 8 dislocation surgeries, and he still continued to play after every surgery. Because if you look at his action, then you realize how bad his shoulder is under forces. The other common cricketing injury is to the lower back, spondylolysis L4-5 and one of the top bowlers and all-rounders, Ian Botham got it. And he was on the verge of ending his career. And one of the surgeons in the room I trained actually did his spondylolisthesis fixation surgery, Mr. Chambers. I was his registrar. And he got him back to his career. Who is this? He is the Health Minister of Government of Gujarat, Mr. Rishikesh Patel. So he invited us to his residence just last week with the medical students from Australia who come for 2 weeks orthopedic training with me about 4 or 5 times a year. And it's been going on since 2019. He only found out just now that something like this is happening in Ahmedabad. And he was very kind. And so that's why education is very, very important. We learn from each other, and it's very much a part of my clinical practice. So these are a few things that I have discussed with you. I have a few videos which can be topic of discussion. I don't want to show you all of them, maybe 1 or 2. And then you tell me how much time I have got, or then you can ask me questions. What I want to do, okay, the other thing I said is about how to get proper knowledge. Now it sounds like a very philosophical question. It won't be asked in the exam. It won't help your private practice. It won't help you get more home visits, right? But actually it will. How to get proper knowledge? Anybody has any idea? There is no wrong answer. Don't say what you want to say.
The best knowledge is sharing. The more you share, the more knowledge increases.
Yes, sharing. Okay, great.
The more
Stand up.
you practice it by yourself.
Okay. You need to know what to practice. Right?
Yeah.
How do you know that?
That also comes with practice. The more you learn and the more you practice.
First chicken or first egg? No?
Trial and error.
Trial and error. Long route. No? What is the quickest and shortest and most accurate way of getting knowledge?
Applying it to oneself,
You have
experiencing
to know it to apply. No? How do you know? I'm starting from the basic point. Observing. Observe. कितना time लगेगा observe करने? So let me give you a practical example. Okay? Any of you, your family member had any orthopedic surgery of any kind? Knee replacement, arthroscopy, carpal tunnel, fracture surgery. Anybody? Your friend? Okay, stand up. So what surgery was done? ACL reconstruction. Right. Now you had concerns, right? Whether it will go correct or not. So what did you do? Did you speak with the surgeon? And what did you ask the surgeon? So the most important thing in acquiring knowledge, this is the basis of education in the Western world. And I know the basis of education in Western world because I've lived there for 26 years. Is asking questions. But most important thing is asking correct question. Now let me take you through that scenario because it will work, it will play out in your lives as you go out to practice. Suppose somebody is needing knee replacement. I am the surgeon. You are sat in front of me. What are the questions you are going to ask me to make sure that your family member gets the correct treatment? Or should I ask the question and answer them myself, or is anybody else going to volunteer? What question will you ask me?
Is it really necessary?
Is it really necessary? Fantastic question. Then what is the other question? So I said, look, ये grade 4 arthritis है, bone on bone है, physiotherapy कर चुके हैं, steroid injection लिया है, cannot walk. So looks like it is necessary. So then what is the next question? Sorry, somebody else said something?
Other options.
Other options other than knee replacement. Okay. So I said, yeah, the other options include osteotomy, or continue with more physiotherapy, take more painkillers. ये वो सब हम कर चुके हैं. Then
Knee replacement which implants you want to use. What is the expense?
expense, so of course I got about that. But which implants? I am asking only for technical questions. Which implants are you going to use? Now you have started a very important line of conversation here. You are now going into the area of technique of knee replacement. Now समझ लो कि I have bought an 8 crore rupee robotic arm. ठीक है? Listen to this carefully. Then what am I likely to say to you? What am I likely to say to you?
Robotic surgeon automobile from outside the country.
I have bought a robotic arm. It's not robot actually, and I am advertising everywhere, giving lectures like this everywhere that I am doing robotic knee replacement. It's actually not robotic knee replacement. Okay? It is robotic arm assisted knee replacement. It's different from robotic. There is no robotic knee replacement. But I have bought this arm and I am claiming robotic knee replacement. So what am I most likely to say to you when you say implant? What am I most likely to say to you? मुझे भी 8 करोड़ का खर्चा निकालना है कहीं से, और 1 साल का मेंटेनेंस कॉस्ट इज अबाउट 1 to 2 crores. So what am I most likely to say? Tell me.
Humans can
Go.
This is the latest technique that is available.
So I am going to sell you robotic arm assisted knee replacement. अभी उसने implant बोला और ये टेक्निक की बात आ गई. Now do you know that every implant company has a robotic arm with which you can only use implant of that company only. And no orthopedic surgeon will have 5 robotic arms. 40 करोड़ तो कोई डालेगा नहीं. So आप वही implant में stuck हो गए जो
जिसका robotic arm है.
So you need to learn a little bit more about the basics of knee replacement. There are 2 kinds of knee replacement. My God, you never knew this before, right? This is magic. Before I say that, 20% of knee replacement patients are not happy. Do you know that?
Yes.
And they are the patients where the conventional technique or mechanically aligned knee replacement is used. X-ray में straight दिखता है, AP में center में दिखता है, lateral में भी center में दिखता है. It is known as mechanically aligned knee replacement. What is the other variety of knee replacement? फिजियोथेरेपी वाला वर्ड है, मजा आ जाएगी आपको. Somebody said something. Huh? What did you say? No. But good try. One is mechanically aligned knee replacement. We can sit down. The other one is kinematically aligned knee replacement. Right? So we call it kinematically. Now, how does the surgeon know what he is doing? How do you do a kinematically aligned knee replacement? That's more successful actually. And it is related to implant. In what way? Have you heard of patient-specific implants? PSI? So, if you use mechanically aligned knee component with a robotic arm, it is only going to give you a better mechanical alignment, if at all. For a surgeon like me, I have been doing knee replacement for 30 plus years. So I can do knee replacement with my eyes shut and one hand tied behind my back while singing a song, and it still falls in the right place. But that particular technique has its own limitations. I have to do a lot of soft tissue release, a lot of things have to be done, certain angles have to be used. That's what robotic arm does instead of the surgeon. So, kinematically aligned knee replacement. Okay, let me give you a practical example of why it matters. The medial side of the tibia, the tibial surface, is more like a C. The lateral side of the tibia, the lateral condyle surface, is more like a D. However, the conventional knee implants, the lateral and the medial tibial surfaces are both mirror images of C only. So we are fitting C into a D. It works majority of the times, but it doesn't work always. Even with the robotic arm assisted surgery, a C is a C and a D is a D. Robotic arm doesn't change that. So that is where patient specific instrumentation and patient specific implants come in. There are 10 years plus studies showing that it gives better results. Then if you combine that with the robotic arm assisted, but that doesn't happen right now. And you know, in my introduction, I think you gave the introduction. Who gave my introduction?
Anuja.
What's your name? Anuja gave my introduction. One of the things she said is that I am a mentor at IHub. Most of the time we don't listen to anybody's introduction. Boring hota hai sir. I am a mentor at IHub. Does anybody know what IHub is? IHub is the technology hub of government of Gujarat for young college graduates and postgraduates who want to do any innovation in any technology, any healthcare sector related field. And I am mentoring, and I have mentored 3 startups. One by a high school girl from Bihar. She was brought to Ahmedabad. Have you heard of Satvik Food Festival? Any of you? It's organized by a professor in IIM, Professor Anil Gupta. He does Shodha Yatra. He walks around the entire country and sees in a village somebody has got some jugaad, some idea, and he takes it to the next level. So he found this girl in the slums in Bihar whose grandmother had a hip fracture and she couldn't climb the stairs. So she designed a little stair climbing walker for her grandmother. Her name is Shalini. So that walker was brought to me, and then we modified it because website. Coming from a poor high school girl's mind. Another startup is a young guy from Jamnagar. He felt that he saw that one of his relatives had some surgery under local anesthetic. It was very painful. They were removing the stitches. It was very painful. Somebody from Jamnagar here? I could see some smiles, so that's why. Yeah. So what he did, he developed these virtual reality goggles, which will give different kind of pictures, and they will be immersive experience. So then I did some shoulder injections, etc., using those goggles, and many other colleagues I told them to use it. And he was then invited by the American ambassador in India, in Delhi, to showcase his product. He was a young guy like you. And then there is a third group from IIT Gandhinagar, 2 girls and 2 boys. They developed a CPM machine. You all know CPM, right? It had so many additional features, and we tried on a few patients. It is now in the market. So iHub supports these youngsters with money, with coaching, with mentorship, and the trade goes all the way to the central government. And it doesn't matter who you are, what your background is. As long as you are genuine, we will support you. What I want you to understand is that being a physiotherapist doesn't mean आज के लिए होम विजिट होती है हॉस्पिटल में कितना पेशेंट होगा. If that is your life and that's what you think you are going to do, then my today's lecture is a waste. If you break out of the barriers, you know which is the biggest risk to take in life? Not taking any risk. Then, so you guys have to think કે અમે પાછલી બેન્ચ પર બેસીને ગોસિપ કરવા સિવાય પણ કશું કરી શકીએ એમ છીએ. બરાબર? So that was the iHub side of things, that everybody can do something like this. So that was about asking the question. You know, I started from kinematics and from mechanical alignment, and in knee replacement, all these factors are very, very important. Okay. So, do you guys have any other questions? Only one thing I will add up is about shoulder dislocation. Does anybody know anybody who had shoulder dislocation? Have you seen any patient of shoulder dislocation ever? Yes? Stand up. What's your name?
Niharika.
Niharika, shoulder dislocation. Tell me something about it. Not that bad one that I showed.
So he has a bad cardiac vision.
So suppose, did any of the boys here have shoulder dislocation in their life? Who had a shoulder dislocation? Yes. Yes, stand up. Now both of you come here at the stage. This is very important, okay? Because these you will see in your real life. And next what I am going to do is to ask all the last benchers to come and sit on the front bench. Or you pay attention. So he comes for the first time with shoulder dislocation. So he is in front of you. What are you going to tell him? His X-ray is done. His shoulder has been reduced. Now he is asking you, कि अभी क्या करना है मेरे को? What will you tell him? Tell him, don't tell me. He is the patient. You are telling him. No. This is the first dislocation. It has been reduced. After injury, he fell down badly. And that is how he dislocated from an Activa. For the first time, he has no generalized ligament laxity also. No epilepsy, nothing. Pure mechanical anterior dislocation. And it has been put back. First time. And he is asking you. Because orthopedic surgeon Dr. Bush said, go for physiotherapy. So now what are you going to tell him?
So I start with strengthening for the cerebral cuff
From day one.
with the right way.
What will you do when you see patient for the first time? Will you give the patient a timeline, a scenario of the possible outcomes? Will you discuss all that? How can you discuss that? Only when you have knowledge. So now I am asking you, first time shoulder dislocation in a 22-year-old boy, reduced. Okay, what will happen? What is most likely to happen to him in the future? And why does recurrent dislocation? What percentage of young boys get recurrent dislocation after the first shoulder dislocation? Any idea? Anybody? Below 25. Any idea? Anybody? What is the conventional treatment? You reduce and put in a sling, right, and start physiotherapy. With that treatment, what percentage of patients are likely to get recurrent dislocation? Google it and then tell me. But at least tell me. 80%. If I told you that I am going to do a treatment for you which is 80% likely to fail, or the failure rate is 80%, will you go with the treatment? Yes or no? Say loudly. Say loudly so that last bench can hear.
No.
No. Does anybody want to go through a treatment which has 80% failure rate? Yes or no?
No.
Say it loud.
No.
But then almost 100% of the patients go through that treatment. Yes or no?
Yes.
Now, why do 80% of them get recurrent dislocation? Why? And why 20% don't get the dislocation? Okay. Anybody any idea?
Not going for proper rehab.
Something inside the shoulder.
Laxity of backside.
Give me specific answer. I am going to extract the answer from you guys, but it will take time. 1 or 2 more minutes. You were saying something. थोड़ा जोर से बोलना पड़ेगा. What has happened inside the shoulder? You have to be very specific. Now you're talking. What of labrum? Weakness. Labrum का
Laxity of labrum.
लेब्रम तो लिगामेंटस फिक्स स्ट्रक्चर है, उसकी लेग्जिंग नहीं हो सकती, मसल में लेग्जिंग.
Slap, if there is any slap tear.
If labrum is detached, so you are going the correct direction. Labrum. If the labrum is torn and detached, it's not going to jump back and sit back in its position again, is it? By itself, yes or no? Okay, this is my socket. Okay, and this finger is the labrum. Now it has gone back. Is it going to jump back by itself and sit here? No. So my socket has become shallow, yes or no?
Yes.
And that is the cause of recurrent dislocation. The labrum is detached in 80% of the patients. And in 20% what happens? Why the dislocation happens? Because the capsule is torn. Capsule can heal very nicely because it is very vascular and it just has to heal. And this 3 weeks rest works perfectly for the capsular damage patients. So now with this knowledge, now you know, first day you have seen him, what are you going to tell him? Because you want to find out whether he's going to be 80% or 20%, right? Yes or no? Then how are you going to find it out? Say loudly so that everybody can hear.
With the MRI finding.
MRI scan finding, right? कोई पेशेंट बोलेगा कि क्या यार पहले दिन डिस्लोकेशन हुआ MRI स्कैन में भेज रहे हो, हाँ?
First we have to diagnose that.
First you have to explain that look, yes, right? There is 80% risk that your labrum is detached and your shoulder will dislocate again and this treatment will fail. If we don't know, the only way to know is find out whether labrum is detached or not, and the only way to know that is with a proper MRI scan. Once you explain this to the patient and then you leave decision with the patient, don't force them. But then you can sleep very well that night because you told them what was good for them. इन्हें मारे जो सारू होते हुए तुम्हें इन्हें कहो, जो उसके लिए अच्छा था वो तुमने उसको बता दिया. Then majority of times they will go for an MRI. और MRI स्कैन में अगर labrum detachment आता है तो what will you do? What will you suggest? Anybody knows about surgery for dislocation of the shoulder? What surgery is done?
But putty,
That is right. Putty is the very ancient surgery. It used to be done. Now this is a fresh injury, so you have got good chance of healing him again. What will you do? What should be done? Anybody else? Okay, back seat में से हर एक को मैं खड़ा करने वाला हूँ. You stand up. So shoulder arthroscopy, you have heard the name? તારું નામ શું છે? કોમલ. Shoulder arthroscopy માં શું કરવામાં આવે? Okay, I'll come to you in there. Okay, you guys can Google what is the surgery for shoulder dislocation. Who is next to Komal? Stand up. मोटे थी वो यार. हाँ? कई surgery? Arthroscopic surgery. Okay, it can be done very effectively. What do you do arthroscopically?
Invasive surgery.
No. Surgery is invasive by nature. When you say surgery, it is invasive. So you do arthroscopic surgery. But what do you do inside? What is done inside? I'm not asking what you will do, but what is done inside to stabilize the shoulder? Examination का तो पता चला कि ये प्रॉब्लम है, करोगे क्या अंदर किया क्या पता है? This is the socket. This is my finger is the labrum. It has gone back here, detached. What do you do? How do you repair it? You stand up. Next to you. Ah, you have to fix it. You have to put it back. बराबर से? सरस, good answer. Everybody clap. सुना करो. Pranjali. So you can get good answer from last page also. In fact, last page you are more intelligent because they are more naughty. Sit down. So you have to bring it back and reattach. There is a technique. Now somebody mentioned hill sex lesion earlier. What is hill sex lesion की बात करें? हाँ. So our patient ने hill sex lesion. What is hill sex lesion? Does anybody know other than Atharo? Okay, shoulder આવી રીતે કયો તારો બગડેલો છે? हाँ, तो left ઉપર ટ્રાય કરીશ. Your shoulder has come out in the front like this, the ball is come out in the front of the socket. What will happen? The back of the humeral head will hit against the glenoid. So back of the humeral head is soft, so the bone will break off. And there will be a defect in the back of the humeral head. That's called Hill-Sachs lesion. If it is a big lesion, then even if you do labrum repair, the shoulder will dislocate again. So what you have to do is there is a muscle at the back of the shoulder in the capsule, and you put that in that defect. Or you do mechanical stabilization, which is known as the Bencart's procedure, or it is known as a bone block procedure. Okay, so then you put a bone block and you do that kind of procedure to stabilize the shoulder in bone. Okay, so it is important. MRI scan will tell you about both. So when if there is a significant Hill-Sachs lesion, then you have to do a bone block, which is originally was known as a Bristol's procedure, and then the French people modified it and called it Leterjet. So there what you do is you take a coracoid process bone and you put it here in front of it. Can be done arthroscopically also. Okay, and we actually do it arthroscopically. So even the bony stabilization can be done arthroscopically. That is the way to treat a recurrent or even a severe shoulder dislocation. If the patient is in 20%, then you guys have to heal that patient. So this was a very, very important thing because so many people roaming around with shoulder dislocations. Right? Any other questions for me from anybody else?
After surgery, patient will do volume treatment of the mind.
Okay, so did everybody hear Niharika's question? Yes. What did she ask? After surgery, will the patient do the normal shoulder movements? So there are two restrictions after stabilization of the shoulder: extreme external rotation and abduction.
Yes.
That has to be restricted. It will be restricted because the capsule has been tightened and the labrum has been repaired. Because when you repair the labrum, generally you take a couple of stitches in the capsule to tighten it, to give extra support. And when you put the bone block, that itself will stop excessive external rotation. So, but in majority of daily activities, it is not a problem. As long as the shoulder is not re-dislocating, the patient is happy. This restriction is lifelong. But how many times in a day do you go like this? Tell me. So, right at the very end of the extreme range of abduction external rotation is where the restriction is. Otherwise, there is no restriction.
Bifurcat lesion, as we discussed in slap lesion.
Say it loudly so everybody can hear.
As in the bifurcat and slap lesion, as you said, there is excess abduction and excess external rotation. I have faced a couple of patients with such abnormalities. Now, these people cannot afford surgery. So with physiotherapy, I have made them repaired, and now they are back to their daily activity. But there are some sort now for 4 to 5 months they are okay, but sometimes they experience the little bit of pain around end range of motion. But they are now able to do their sport, they are able to go to their gym and everything. So this pain or anything can we do about it without surgery?
So what you said is very interesting. You said they can't afford surgery, but they are still going to gym and doing sports. There is a contrast in that. If I can afford gym, then I can afford probably surgery also. That's first thing. See, this takes me, this is a very serious topic. The current healthcare model, you guys will have to understand, is known as biopsychosocial model of healthcare. Biology is what we are talking about. अंदर क्या हुआ, क्या fix करोगे? Psychology is somebody has fear of surgery. Now, if somebody has fear of surgery, they will create an entire cocoon and a bubble of excuses around it. I cannot afford, मेरी शादी है, मेरे बड़े पापा ने ना बोला है, my boyfriend doesn't want me to do it. Nobody tells. One or two have told me this secretly. So that's a joke. But there are several reasons people give to avoid surgery. And that is a psychological aspect. And then there is a social aspect where the affordability, time of work. Okay, I will give you an extreme example of social factor, okay? And some of you will probably cry. Actually, two examples. One from a very poor background, one from an ultra-rich background. So we went to a village in Rajasthan for one of the camps, not the marketing camp that the big hospitals do. This was a proper health camp. One 14-year-old girl was brought by her father. He was dressed in a very ordinary clothes and she had a tumor, osteosarcoma of the proximal humerus. And they had taken her to a good hospital somewhere and they said कि वैसे तो इतना खर्चा होगा हम 1-2 लाख में कर देंगे. But they had 6 children and they could not afford it. सीधी बात है, other people cannot afford it. And he was a daily laborer. So I said, don't worry, because at 14 years of age, you don't want to remove just the tumor, but you want to put a new tumor prosthesis from a company called Link in Germany. So I had some contacts, I phoned them, and I said, you have to give it to me for free. What is the cost of the prosthesis? 12 lakhs. So they said, we will give it to you for free. Then I convinced a few surgeons, a few doctors and few other people, and we collected. Eventually they agreed to the half price. So 6 lakhs they will give, 6 lakhs we will have to pay for the prosthesis. So I created the full funding, chemotherapy, ये वो करके 20-30 lakhs का. Then we informed the father that you can bring her. He said मगर वहाँ रहेगा कौन उसके साथ? मैंने बोला कि आपके you or your wife और कि हम में से कोई भी रहेगा तो डेली वेजेस है तो हमारे बाकी के 5 बच्चे क्या खाएंगे? So she died in 6 months. That's why when you get married in our Indian culture, original Indian culture, there was a vow which was taken to have an Ashtaputra Bhova. You heard of that? Have 8 children. Because ultimately something will happen. If you have only 1 or 2 children, something will happen to them. There will be nothing left. But we have gone in a very wrong direction. Anyway, that's a social side of it. Another social example in extreme, from a family from the richest area of Ahmedabad that you can imagine. From one of the most expensive houses worth about 25 crores. Okay? Auntie Ji, we did a spine surgery for her. She went to USA for some wedding, came back, fell down, she had a hip fracture, only crack, we treated it non-operative, she got better. And her children used to come from abroad all the time and she was very upset that one of the daughters keeps on coming from abroad and she leaves her own daughter and husband alone and not caring for them. Dikri to sasrej shoge. Auntie Ji had very clear conviction. So she was very upset. Every year the daughter used to come for 2-3 months. That is why I have lived abroad, so I am every vacation we would come back to India. So as a son it is fine. When the daughter comes and then her husband and children are there, some parents will upset. So one day the daughter called me on a Sunday. She is a good friend of mine. She said, "Kya chho?" Because I am somewhere outside. So mummy ne laine ER ma આવું છું. શું થયું? પડી ગયા પાછા પકડના ના. What has happened? મમ્મી એસિડ પી લીધો છે. 89 years old. શું પી લીધો છે? Acid. They couldn't save her. She died a painful death. I could hear the screams on the phone. કેમ એણે એસિડ પી લીધો? એણે લખ્યું એના પીલો નીચેથી સુસાઇડની બધી નોટ. છેલ્લા 6 મહિનાથી માસી બધા છાપાઓમાં જેટલા સુસાઇડ થયા એણે કઈ પદ્ધતિથી કર્યા એની કાપલીઓ બનાવી રાખી. આમાંથી કઈ મેથડ મને મારી પોતાની મેળે હું કરી શકું. અને આગલે રાતે એને દીકરીને કીધું તારી તું ટિકિટ બુક કરાવ પરદેશની છે મને બતાવે તારે કાલે પાછા જવાનું તારે કરે હવે ફરીથી કોઈ દિવસ તું હસબન્ડ અને ચિલ્ડ્રનને છોડીને પાછી નહીં આવવાનું. She had no funeral, no basma, બધી જણે ના પાડી. Nothing. Shocked? So healthcare is not simply our technique, our method, yes or no. When patients tell you something, as a doctor, as a physiotherapist, you have to rise above the emotions and try and look, or even your own preferences. ઘણી વાર મને એવું થાય કે યાર હું પેશન્ટને ફિઝિયોથેરાપી પાસે શું કામ મોકલું, મારી નીચે તો મને ફાયદો થાય ને. Sometimes physiotherapy also think like that. હું orthopedic surgeon પાસે મોકલીશ તો પછી હવે શું થશે? These kind of considerations also play a part. So if you work as a team, then it will not happen like that. Like the example of somebody with shoulder problem in here, right? It's very easily curable. So whenever you have these kind of problems, go beyond your emotions, go beyond your own narrow personal or commercial interests. Then in the long run, not only your patients will benefit, which is why we are here, but also you will benefit in two ways. Your name will be taken with greater respect, at least by people who know and have benefited from you, and you will earn more also. And it will be ethical earning. Okay? So, getting your emotions involved is not hard, and making a considered knowledgeable decision and executing is hard, whether it is knee, shoulder or anything. Okay? Thank you. Siddharth, always pleasure to catch up with him. You are running a wonderful institute, and I am sure your students will be excelling everywhere. Yes. Okay.